Hello, beautiful Limeys. It's Dr. Christine Arseneau, PharmD, Functional Medicine Certified Health Coach. And just wondering how many of you have tried cannabis and how did it work for you? I'm a cannabis pharmacist for those who don't know, cannabis coach. I help people use cannabis medicine, people that are interested in it, and I find it helps with a lot of Lyme symptoms. And I'm curious if you've tried it and how it worked for you. So drop me a comment, let me know if it's worked for you. And if you haven't tried it, I also would like to know why not. So what I found is there's still a stigma that comes with cannabis, and there is also this fear of THC. So how many of you have had the fear of THC and you don't want to get high? I feel like that deters a lot of people. And I don't think THC gets a good reputation like CBD does, but I think that THC definitely has its place and it definitely has health benefits. And so let's just talk about the endocannabinoid system in general. It's the system of neurotransmitters we have in our body that the science on it's still pretty new. They still aren't teaching it in a lot of medical schools. They are in some now. But up until recently, doctors haven't learned about this. And the endocannabinoid system actually has more receptors than different other neurotransmitters in our brain. And the endocannabinoid system is responsible for homeostasis. So that means it keeps everything in balance. So it kind of balances you out, keeps things where they need to be, and helps with pain relief. It helps with anxiety, helps with immune modulation and inflammation and decreasing inflammation, most importantly. Also neuroprotection. And the endocannabinoid system also regulates your microbiome. And there's a lot of evidence about microbiome and how it affects your health, and a lot of interesting stuff with gut health. So I do invite you to start looking at your gut if you haven't really considered gut health before. But the endocannabinoid system balances all of these things, and because different people have different needs, and homeostasis is all about bringing you back into balance, there's not like one dose that works for everybody. So challenging thing with cannabis medicine is finding the dose. It's not going to be like you go to the doctor, they give you a certain dose, you try it, it doesn't work, you double it. Like, it's not that simple. You have to find your optimal dose. And so some people give up with cannabis before it's had a chance to really reach its full potential, reach its full benefits. So that's why I'm curious to know if you've ever tried cannabis and how it worked for you, or if you haven't tried it, why. And so the THC part is the part a lot of people fear, the getting high. But I just wanted to talk about the benefits of the THC. Not only does it have different health benefits just in how it fits in with the endocannabinoid system, but also that THC component, that part that makes you psychoactive, that can have its part in healing too. It can make you more self-aware. Can make you maybe aware of some of your emotions. It can make you maybe aware of some of your thought patterns and maybe the negative ones that are impacting your health. It can make you feel more connected to others, more connected to the universe or spirit or God or however you want to describe it. It just gives you a different vantage point, a different view when it comes to healing. It can kind of remove you, even when it helps with pain. It's like sometimes it's just kind of removing you so you're further away from the pain. It's still there, it exists, but you're able to see it in a different way. And it's more tolerable, and you're like more gentle with yourself. And so you can really have that intentionality when you use THC to connect with your higher self, to connect with source, and it doesn't have to be demonized just because it's a psychoactive proponent. And people say that CBD isn't psychoactive, but I don't think that's an accurate statement, because CBD does help with anxiety, and there's data with it in depression and things like that. So it does affect you. It just doesn't give you the same type of high like the THC does. Yeah, so some people use cannabis products for pain, some use it for sleep, some use it for nausea or other gut issues. There's data that it improves spasticity in MS. Um, yeah, and it has antimicrobial properties and antioxidant properties as well. So there is a whole kind of host of symptoms that can help with, and a lot of these symptoms are things that affect people with Lyme disease. So might be something that you could consider, and you just have to keep in mind that the dosing is different for everybody. It takes some trial and error. There's some things you want to keep in mind when you're picking products, and you just kind of have to do your own research on this or work with a cannabis coach or somebody that can help you through the process, and realize that it might take a little bit more patience than a typical pharmaceutical prescription that you would get. So let me know in the comments below if you have had benefits from cannabis medicine and what exactly it helps you with. Hope everybody has a wonderful day.